3 years ago today, I got my PhD. I defended my proposal. I defended my dissertation. 222.
Okay, good morning, everyone. Welcome to your first aid CPR training this morning. So, a couple things. We are presenting with a DVD, which is kind of antique, but we do not have access to this online. So we're going to have to use the DVD. So the video and the audio, we can present one or the other. So what you're going to hear is the audio from the owl. So just make sure you turn your volume up on your computer or whatever you have. Yes, vintage for sure. So what the process is, Dr. Lipchick is here with me. What we're going to do is run through the videos. If you have any questions, send her emails and she'll answer those. We don't want to stop in between because we don't want the DVD to stop and have issues that way. So it's pretty self-explanatory, but if you have any specific questions, please send an email to Dr. Lipchick. Also, if she has students that have any, that are diabetic or have any special medical concerns, she will reach out to the teachers and make you guys aware of those concerns for the students. So we're going to get started. We're going to start off with first aid, and then we're going to go from first aid to CPR and then AED. So hopefully we'll only have you here for about 30 minutes.
While some of the care you provide may be for serious conditions that will require more advanced care, most situations will only require simple first aid. If you know basic first aid, you can care for most conditions, including cuts, bruises, stings, and minor burns. But it's also important to be able to recognize serious conditions, such as shock, serious bleeding, and broken bones, because these conditions require more advanced medical care. In this program, you'll learn the importance of checking the scene for safety and keeping yourself safe while providing care. How to determine what's wrong and whether a victim needs more advanced medical attention. How to identify and care for wounds, muscle, bone, and joint injuries, and sudden illnesses. Though you may not use your first aid skills frequently, you'll be prepared for an emergency should it occur. Bystanders are the first link in the EMS system, recognizing a situation as an emergency and acting to help victims. In an emergency, check the scene first. Look for hazards that could be dangerous to you, the victim, or bystanders. The possible cause of the problem. Is it an injury or an illness? And the number of victims involved. Determine if the condition is minor and only requires basic first aid or serious, in which case more advanced medical care is needed. For serious conditions, call your local emergency number, usually 911, and request an ambulance. Serious conditions that require professional medical care include loss of consciousness, such as fainting or seizure, persistent chest or abdominal pain or pressure, sudden dizziness, weakness, or change in vision, difficulty breathing, bleeding that cannot be controlled, problems with movement or sensation following an injury, suspected spinal injury, severe burns, poisoning or drug overdose, and severe or persistent vomiting. When you call 911, a trained dispatcher can talk you through an emergency. Speak slowly and calmly. Respond to the dispatcher's questions with your name, the telephone number you're calling from, a description of what happened, the location of the victim and the victim's condition if known, and the number of people who need help. Stay on the phone unless the dispatcher tells you to hang up. The dispatcher may also tell you how to best care for the victim until EMS personnel arrive. Although your risk of contracting a disease is low when offering first aid, simple precautions can protect you from blood-borne diseases such as hepatitis B or C, HIV, or airborne diseases such as tuberculosis. Wear disposable medical exam gloves to protect against blood-borne disease if you might contact bodily fluids such as blood or vomit. If gloves aren't available, use whatever's handy, like a plastic bag or clean cloth. People can often stop bleeding from minor wounds themselves by using their own hands to apply pressure. After victims receive proper care, clean up blood and bodily fluids in the area using a disinfecting solution like diluted bleach. Discard contaminated materials in an appropriate waste container. Wash your hands and any other parts of your body that were contaminated. If soap and water are not available, use antiseptic wipes. For an exposure at work, contact your supervisor. Ask about testing or other follow-up procedures, or contact your own physician. If giving rescue breaths during CPR, use a barrier device if available to help protect against blood-borne or airborne diseases. When you are sure the scene is safe, try to determine if the problem is an injury or a sudden illness. With any victim, do a primary check. This involves checking quickly for responsiveness, breathing, and severe bleeding, and only takes seconds to complete. To check for responsiveness, tap and shout to see if the victim responds. At the same time, look quickly at the chest to see if the victim is breathing normally. If the victim is not breathing or is only gasping, have a bystander call 911 while you start CPR, beginning with chest compressions. If a victim can speak to you, he or she is responsive and breathing and can likely tell you what's wrong. Complete the primary check by looking for any severe bleeding and controlling it if present. With the primary check complete and no life-threatening conditions requiring care, check for secondary items. This includes a quick physical check for any injuries and gathering information that might be helpful in your immediate care or for EMS providers if called. Use the mnemonic DOTS to help identify signs and symptoms of injury as you check the victim. DOTS stands for deformity, open wounds, tenderness, swelling. Most victims will be able to tell you where they are injured. Focus your attention there. For a victim that may have multiple injuries, quickly examine the entire body, starting at the head and working your way down. Be careful not to apply pressure to the areas that are painful. When checking the head, look for blood or fluid in the ears or nose. Check the mouth for objects that could block the airway, such as broken teeth. Check the neck, chest, abdomen, and pelvis for any abnormalities. Check each leg and foot. Ask the victim to move his or her foot, if possible, without causing pain. Repeat this sequence for each hand. For an alert victim, you can use the mnemonic SAMPLE to ask questions and gather important information about the victim's condition. SAMPLE stands for signs, symptoms, allergies, medications, previous conditions related to this problem, last time the victim ate or drank, events leading up to the problem. There are 3 general types of bleeding: capillary, where the blood oozes slowly from a wound; venous, where blood flows steadily from a wound; and arterial, where blood spurts from a wound. There are several types of open wounds: abrasions, lacerations, incisions, punctures, and avulsions. Regardless of the type of bleeding or type of open wound, follow the same basic steps to control bleeding. Minor wounds can be cleaned with soap and water to prevent infection. Flush the wound with running water. Apply an antibiotic ointment and cover the wound. Seek medical attention for wounds, such as puncture wounds that have a higher risk of infection. For more serious wounds, place a dressing over the wound and apply pressure. This action stops most bleeding in a few minutes. With a dressing covering the wound, apply a pressure bandage to maintain pressure. Wrap a roller gauze bandage in a spiral pattern snugly over the area, but don't apply it so tightly that it cuts off circulation. If blood soaks through the dressing and bandage, apply another dressing and bandage on top of the first one. Call 911 if bleeding cannot be controlled. Amputations are injuries where a body part is cut off. Control the bleeding and care for shock. Recover the amputated part and wrap it in a dry, sterile gauze pad or clean cloth. Place it in a plastic bag or other waterproof container. Keep the part cool if possible, but do not freeze it. Impaled objects come in different shapes and sizes. Leave an impaled object in place and hold it steady to avoid movement. Whenever possible, use bulky dressings to surround and stabilize the object. Bandage the object with dressings in place and seek medical attention. Internal bleeding occurs when a blunt object does not break the skin, but it does cause blood vessel and tissue injury that results in characteristic bruising and tenderness. To care for minor internal bleeding, apply an ice pack for about 20 minutes and then an elastic bandage for 2 to 3 hours. Repeat this process for 24 hours. For more serious internal bleeding, call 911. The 3 components of the circulatory system are a working pump, the heart, a network of pipes, the blood vessels, and fluid, the blood. Damage to any component can reduce oxygen in the blood and cause shock. failure component can reduce oxygen in the blood and cause shock. Pump failure happens, for example, in cardiac arrest, when the heart does not pump enough blood. Fluid failure would happen when blood is lost during serious injury, or when fluids are lost in severe vomiting and diarrhea. Pipe failure can happen in a spinal cord injury or a severe allergic reaction, when blood vessels enlarge and there is not enough blood to fill them completely. People in shock may seem anxious or restless, with pale, cool, and clammy skin and rapid breathing. To care for shock, attend to any immediate life-threatening conditions. Responsive victims should be laid on their backs and kept warm. One type of shock, anaphylactic shock, is a severe allergic reaction to substances either eaten or injected. Anaphylaxis may be brought on by medications, foods such as peanuts or shellfish, insect stings, or dyes used in medical procedures. Anaphylaxis is life-threatening and requires immediate medical attention. Signs and symptoms may appear within minutes and include difficulty breathing with shortness of breath and wheezing. Skin reactions such as itching, rash, or hives, especially on the face, neck, or chest. Swelling of the tongue, mouth, or throat, and dizziness. To care for anaphylaxis, call 911 for immediate medical attention. Have a responsive victim sit in a comfortable position if breathing difficulty exists. If the victim has a prescribed epinephrine autoinjector, help with its use. Hold the injector firmly and remove the safety cap. Support the victim's thigh to avoid movement during injection. Place the tip of the autoinjector near the outer thigh. Push the autoinjector firmly against the thigh. Hold it in place for several seconds as indicated on the device. Head injuries range from common nosebleeds to serious skull fractures and brain injury. For a shallow scalp wound, apply a gauze pad, pressure, and bandage over the wound. For an injury involving a possible skull fracture with external bleeding, apply pressure around the edges of the wound to control bleeding. Keep the head and neck from moving and call 911. Chemical injuries to the eyes require immediate care. Hold the eyes open and flush continuously with water. Loosely bandage both eyes with wet dressings and seek medical attention. Motor vehicle crashes and falls from a height are common causes of spinal injury. If you believe a victim has a possible spinal injury, stabilize the head and neck to avoid movement and call 911. Most nosebleeds occur from minor blunt injury. To care for a nosebleed, have the victim sit down and lean slightly forward. Pinch the nose firmly. Bleeding usually stops in a few minutes. Injuries to the mouth can include the loss of permanent teeth. To care for mouth injuries, stop the bleeding. Place any missing teeth in milk, saliva, or water and get the victim to a dentist. Rib fractures are often closed chest injuries caused by blunt trauma from a blow or fall. To care for rib fractures, help the victim get into the most comfortable resting position. Stabilize the injured area with a pillow, blanket, or other soft, bulky object, and call 911. Abdominal injuries can be closed or open. For either type of injury, place the victim in the most comfortable position with the knees bent. Care for shock and call 911. If organs are protruding, cover them loosely with a moist, sterile dressing. Care for shock and call 911. Joint injuries are common and often only involve the overstretching or tearing of ligaments that hold bone ends in joints, such as the shoulder, wrist, knee, and ankle. For joint injuries, such as a sprained ankle or injuries to the muscles in the arms or legs, use the mnemonic RICE to guide your care. Rest, ice, compression, elevation. Rest means the injured part must not be used. Ice should be applied quickly for 20 minutes. After removing the ice, apply compression with an elastic bandage for 2 to 3 hours. Elevate the part while applying ice and compression. During the first 24 to 48 hours, alternate 20 minutes of ice with 2 or 3 hours of compression whenever possible. A strain is a muscle injury that occurs as a result of muscles tearing when stretched beyond their normal range of motion. Use RICE procedures to provide care. Muscle cramps are painful, uncontrolled spasms that restrict movement. To relax a muscle spasm, victims can gently stretch the affected muscle while resting. Cramped muscles may also be relaxed by applying pressure to them. A commercial sports drink may also help. The terms fracture or broken bone both mean a break or crack in a bone. Fractures can be open. Fractures. The terms fracture or broken bone both mean a break or crack in a bone. Fractures can be closed or open. Closed fractures are most common and occur when the skin is not broken anywhere near the fracture site. Open fractures are less common, but more severe. They occur when the skin over the fracture has been damaged or broken. A dislocation occurs when ligaments holding bone ends in joints are torn, allowing bone ends to come out of the joints. Though dislocations are often noticeable, fractures may not always be visible or obvious. This is why X-rays and other medical procedures are used to determine the extent of the injury. Use the mnemonic DOTS to assess a victim for a possible fracture or dislocation. Deformity, open wound, tenderness, swelling. Look and gently feel for deformity, comparing the injured part with the uninjured part on the opposite side of the body. Deformity is a reliable sign of fracture or dislocation. Open wounds may indicate underlying fractures, although most fractures will not have accompanying wounds. Gently feel along the bone. Tenderness and pain are commonly found at the injury site. Swelling is typical after a fracture. Another likely indication of fracture or dislocation is the inability to use the injured area normally. When the ends of a broken bone rub together, a grating sensation can be felt, and that sound may be heard. Victims may also have heard or felt the bone snap when injured. To care for possible fractures or dislocations, stabilize the affected area to avoid movement and further injury. If available, apply ice to control swelling and help ease pain. Seek medical attention. Call 911 for any injury to large bones, such as the leg, where transport to a medical facility would be difficult. Splinting is the process of securing an injured part to avoid movement and further injury. An easy method of splinting is to use a self or anatomic splint to bind the injured body part to an uninjured part of the body. Create a sling from a triangular bandage. Then use a second triangular bandage to bind the injured arm to the chest. If you have a rigid object, position it along the injured arm, with the hand in its normal position. Use a roll of gauze or several triangular bandages to secure the splint to the arm. Use one triangular bandage to create a sling and a second triangular bandage to bind the injured arm to the chest. If you have a soft, bulky object, such as a pillow or rolled blanket, place it around the injured arm. Use several triangular bandages to secure the soft splint to the arm. Use one triangular bandage to create a sling and a second triangular bandage to bind the injured arm to the chest. Chest pain can occur for several reasons, such as respiratory infection, muscle pain, or the most serious, heart attack. Heart attacks occur when the blood supply to the part of the heart is severely reduced or stopped, often because coronary arteries become blocked. Early recognition and treatment of a heart attack provides the best chances for survival and full recovery. Victims of possible heart attack are best cared for immediately at the nearest hospital offering emergency cardiovascular care. Call 911 for help from trained dispatchers who can provide instructions for care while emergency personnel are on the way. Victims of possible heart attack should rest in a comfortable position and loosen any restrictive clothing. Provide aspirin if available and assist with any prescribed heart medication, such as nitroglycerin. A person can experience difficulty breathing for many reasons, including chest injuries and medical conditions such as heart attack, anaphylaxis, and asthma. Signs of breathing difficulty include abnormally rapid or slow breathing and noisy breathing, including gasping sounds or wheezing. A person with serious breathing problems may also be unable to speak in complete sentences. To care for a victim with difficulty breathing, help the person into the most comfortable position. This is often a seated position. Call 911. If the victim has a prescribed inhaler for the condition, assist with its use. The proper use of an inhaler requires that the medication be deeply inhaled and held in the lungs. The victim should forcefully exhale and then place the inhaler in his mouth. Dispense the medication, breathe in deeply, and hold it for several seconds. Fainting is a form of shock that results in a brief period of loss of consciousness. This happens when blood flow to the brain is interrupted. Causes include exhaustion, lack of food, and reactions to pain. Regardless of the cause, the care is the same. Check responsiveness and breathing.
Are you okay?
Position the victim on her back. Call 911 if the victim does not quickly regain consciousness or has repeat fainting episodes. A seizure results from an abnormal stimulation of brain cells and can occur from conditions such as epilepsy, heat stroke, diabetic emergencies, fever, and brain injury. Some seizures are very mild, without muscle contractions, and can be sometimes confused with daydreaming. Others are more severe, causing loss of consciousness and violent muscle contractions. To care for a victim having a severe seizure, make the area safe and be sure 911 has been called. Roll the victim onto his side to help keep the airway clear. The body is continuously balancing sugar and insulin to function properly. When the blood sugar level is too low, it's called hypoglycemia. In this condition, the brain is starved for sugar. Signs can occur within a few hours and include confusion, anger, poor coordination, pale, cool, sweaty skin, and loss of consciousness. When the blood sugar level is too high, it's called hyperglycemia. This can result from insufficient insulin, and the sugar cannot get into the cells. This condition has a gradual onset over days. Victims have warm, dry skin, fruity breath odor, extreme thirst, and frequent urination. Though diabetics frequently monitor their food intake and blood sugar level, problems can still occur. If you are uncertain about whether the victim has high or low blood sugar, provide sugar such as a glass of fruit juice, can of soda, or several glucose tablets that the diabetic may have. If the condition improves in a few minutes, then make sure the victim eats a proper meal. If the condition does not improve, call 911.
Sudden cardiac arrest claims hundreds of thousands of lives each year. Lay rescuers are often first on the scene and provide valuable care until EMS personnel arrive. In this program, you will learn how to recognize different emergencies and how to provide the proper care for each. You will be able to recognize and care for choking victims, as well as those experiencing chest discomfort associated with heart attack. You will also learn how to rapidly assess a victim who is in cardiac arrest and how to provide potentially life-saving care, such as cardiopulmonary resuscitation, commonly called CPR. You'll also learn how to use an automated external defibrillator, commonly called an AED. When you approach a motionless adult, tap and shout to check for responsiveness, and look at the chest to see if the victim is breathing normally. If the victim is unresponsive and not breathing normally, send someone to call 911 as you begin CPR. CPR is a combination of chest compressions and rescue breaths. With your arms straight and shoulders over your hands, push the chest down at least 2 inches and let it return to its normal position. Give 30 chest compressions in about 18 seconds. After 30 compressions, move to the victim's head. Tilt the head back and lift the chin to open the airway. This action moves the tongue away from the back of the throat in an unresponsive victim. Pinch the nose and give 2 normal breaths. Each breath should last about 1 second and make the chest rise. Use a barrier device during rescue breathing, such as a face shield, if available, to help prevent the possibility of disease transmission. Repeat cycles of 30 chest compressions and 2 rescue breaths until an automated defibrillator is available, until the victim is revived, until you are relieved by someone else capable of performing CPR, or until you are too exhausted to continue. Whenever an automated defibrillator, commonly called an AED, is available, stop CPR and use the device. Apply the AED pads to the victim and follow the prompts of the device. AED use is explained in a later section of the program. If a breath does not make the chest rise, retilt the head and try another breath. If still unsuccessful, assume the airway is obstructed and give 30 chest compressions to dislodge the obstruction. Look for an object in the mouth and remove anything visible. Reattempt breaths. This is usually all it takes to dislodge an object and clear the airway. Child CPR is very similar to adult CPR, with only a few differences. If you are alone with a child, perform 2 minutes of CPR before calling 911. When performing child CPR, you can use 1 or 2 hands. Chest compressions should be approximately 1/3 the depth of the chest. This will be approximately 2 inches. Child CPR is covered more completely in another section of the program. Airway obstruction or choking can cause death within minutes. Coughing is the best action victims can take right away. If victims are responsive but cannot breathe, speak, or cough, it is a severe airway obstruction. Provide immediate care. Give abdominal thrusts, also known as the Heimlich maneuver. Stand behind the victim, locate the navel, and place your fist just above it. Grab your fist with your other hand and give quick inward and upward thrusts. Repeat the thrusts until the obstruction is expelled or the victim becomes unresponsive. For a large victim or one in the late stages of pregnancy, use chest thrusts instead of abdominal thrusts. Stand behind the victim. Place your arms under the armpits and hands on the chest instead of the abdomen. Two cardiovascular emergencies, heart attack and stroke, happen most often to older adults. Heart attacks occur when the blood supply to part of the heart is severely reduced or stopped, usually because coronary arteries become blocked. Early recognition and treatment of heart attacks offer victims the best chances for recovery. Signs of heart attack include shortness of breath, rapid or irregular heartbeat, nausea, vomiting, sweating, fatigue, or chest pain or pressure that may radiate to the arm, neck, jaw, or back. Stroke occurs when the blood supply to the brain is disrupted, often when cerebral arteries are blocked or rupture. Signs of stroke include sudden onset of severe headache, loss of consciousness, partial paralysis, or abnormal speech. Possible victims of heart attack or stroke are best treated immediately at the nearest hospital offering emergency cardiovascular care. Call 911 for help from trained dispatchers who can provide instructions for care while emergency personnel are on the way. Potential heart attack victims should rest in a comfortable position and loosen restrictive clothing. Assist with any prescribed medication, such as nitroglycerin, and if available, give 1 regular aspirin or 4 chewable aspirins. For potential stroke victims, make sure 911 has been called and help the victim to rest in the most comfortable position. Loosen any restrictive clothing and monitor the victim's condition until EMS personnel arrive. Children do not often suffer heart attacks like adults. Instead, major problems in children relate to breathing. But if a child's breathing problem is not cared for promptly, cardiac problems can result. Before providing care, assess the child's condition. Always handle any immediate threats to life by checking responsiveness and breathing. When approaching a motionless child, tap and shout to see if there's a response. Victims who can speak, move, or react are described as responsive. Victims who do not respond are considered unresponsive. While checking responsiveness, also look at the chest to see if the victim is breathing. If the victim is unresponsive and not breathing or only gasping, CPR is needed as well as more advanced medical care. Ask a bystander to call the local emergency number, usually 911. If you are alone with an unresponsive, non-breathing child, perform 2 minutes of care. Then make the call to 911 yourself and return to care for the child. CPR is a combination of chest compressions and rescue breaths. Give 30 chest compressions in about 18 seconds. Chest compressions can be given with 1 or 2 hands to compress the chest about 2 inches. After 30 compressions, move to the child's head. Tilt the head back and lift the chin to open the airway. This action moves the tongue away from the back of the throat in an unresponsive child. Pinch the nose and give 2 normal breaths. Each breath should last about 1 second and make the chest gently rise. You may want to use a breathing device during rescue breathing, such as a face shield, if available, to help prevent the possibility of disease transmission. Repeat cycles of 30 chest compressions and 2 rescue breaths until an automated defibrillator is available, until the victim is revived, until you are relieved by someone else capable of performing CPR, or until you are too exhausted to continue. Whenever an automated defibrillator, commonly called an AED, is available, stop CPR and use the device. Apply the AED pads to the victim and follow the prompts of the device. Use pediatric pads if they are available for the device. AED use is explained in a later section of the program. If a breath does not make the chest rise, retilt the head and try another breath. If still unsuccessful, assume the airway is obstructed and give 30 chest compressions to dislodge the obstruction. Look for an object in the mouth and remove anything visible. Reattempt breaths. This is usually all it takes to dislodge an object and clear the airway. Airway obstruction or choking can cause death within minutes. In children, foods like hot dogs, candy, peanuts, or grapes, and items such as coins, balloons, or marbles can obstruct the airway. If victims are responsive but cannot speak, cough, or get a breath, or if they produce only a weak, ineffective cough or a high-pitched crowing noise, treat as if the airway is completely obstructed and begin abdominal thrusts, also known as the Heimlich maneuver. Stand behind the child and place your fist just above the navel. Grab your fist with your other hand and give quick inward and upward thrusts to the abdomen. Repeat the abdominal thrusts until the object is expelled or the child becomes unresponsive. Sudden cardiac arrest claims hundreds of thousands of lives each year. Lay rescuers are often first on the scene and provide valuable care until EMS personnel arrive. When you approach a motionless adult, tap and shout to check for responsiveness, and look at the chest to see if the victim is breathing normally. If the victim is unresponsive and not breathing normally, send someone to call 911 as you begin CPR. With your arms straight and shoulders over your hands, push the chest down at least 2 inches and let it return to its normal position. Repeat chest compressions until an automated defibrillator is available, until the victim is revived, until you are relieved by someone else capable of performing CPR, or until you are too exhausted to continue. Whenever an automated defibrillator, commonly called an AED, is available, stop CPR and use the device. Apply the AED pads to the victim and follow the prompts of the device. Every year, hundreds of thousands of people die from sudden cardiac arrest. Most incidents occur at home, but cardiac arrest can happen anywhere, at work, while traveling, or during recreation. The quick actions of laypersons to recognize a life-threatening condition call 911, and provide CPR are important in saving the life of a victim of sudden cardiac arrest. Early defibrillation by lay rescuers using an automated external defibrillator, or AED, has been proven to save lives. The next program segments show how the heart works, the common elements among all AEDs, how to operate an AED, special situations when using an AED, and how to properly maintain an AED. The heart is a muscle with 4 hollow chambers that pumps blood throughout the body. An electrical conduction system coordinates its regular rhythmic action. Complications from heart disease or from sudden events like electrocution may disrupt the body's electrical signals to the heart. The result is abnormal heart rhythms, disrupted circulation, and potential cardiac arrest. After 8 to 10 minutes of arrested circulation and abnormal rhythm, damage may be so extensive that survival is not possible. The 2 most common abnormal heart rhythms are ventricular fibrillation, or VFib, and ventricular tachycardia, or VTAC. Ventricular fibrillation is chaotic, uncoordinated electrical activity. VFib stops blood circulation because the heart cannot pump any blood. Ventricular tachycardia means the heart beats too fast. VTAC stops blood circulation because the heart cannot pump effectively. Because both VFib and VTAC respond to defibrillation, the earlier an AED can be used, the greater the chance a victim will survive. Automated external defibrillators, AEDs, are electronic devices that analyze heart rhythm, determine the need to shock, and deliver a shock through cables and pads placed on the chest. AEDs vary from basic units that lay people can operate to those with advanced features helpful to professional rescuers. AEDs have common features, including a power button to turn the unit on and off, cables and electrode pads to attach to the victim, capacity to analyze heart rhythm, capacity to deliver a shock when needed, voice prompts to guide users through the procedure. It is now safe to touch the patient. And the capacity to store and retrieve data. Some devices are semi-automatic, requiring the rescuer to push a button to administer a shock. Do not touch patient. Analyzing heart rhythm. Please wait. AEDs are simple to operate. With voice prompts as a guide, using an AED is easy. Press red flashing button to deliver shock. Voice prompts tell you each step to perform. You don't need to remember the process. Shock delivered. It is now safe to touch the patient. Regardless of AED make or model, all units follow the same basic steps. Turn on the device. Apply electrode pads to the victim's bare, dry chest. Analyze the heart rhythm. And deliver a shock if indicated. Before using an AED, determine if the victim is unresponsive and not breathing. Then perform CPR until an AED is available. Once an AED arrives, turn on the device and follow the prompts. Stay calm. Follow these voice instructions. Make sure 911 is called now. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the two locations shown. Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location exactly as illustrated. Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch patient. Analyzing heart rhythm. Please wait. Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. A fully automatic device will indicate the need for shock and then deliver the shock itself. You should give one shock, followed immediately by 2 minutes of CPR. The AED will then reanalyze the rhythm and advise how to proceed. Repeat this process until EMS personnel arrive and take over. Familiarize yourself with the operation of any specific AED that you will be using, so you recognize its prompts and can check or correct unexpected messages.
No shock advised.
A no shock advised prompt means the AED was not able to detect a shockable rhythm. Continue CPR if needed.
Motion detected.
A motion detected prompt means you need to check that no one is touching the victim and that the victim is still unresponsive and not breathing.
Check pads for good contact.
Check that the cable is solidly attached to the AED and that the electrode pads are securely attached to the victim. If the electrodes are in place and the AED voice prompts indicate a problem with electrode placement, hair may be getting in the way of direct contact between the electrodes and chest wall. Use a razor to quickly shave the hair in the area of the pads. Skill using an AED.
Different types of AEDs are available, but all are similar to operate and have some common features, such as illustrations on the pads showing where to apply them and audio voice prompts to guide using an AED.
When breathing has stopped, the heart will too. In addition to CPR, an AED can help save a life. During CPR and when an AED becomes available, use it as soon as possible. Expose the chest. If wet or sweaty, wipe it dry. Turn on the AED.
Stay calm. Follow these instructions. Make sure 911 is called now.
Attach the pads to the person's bare, dry chest.
Remove white square package from lid of AED. Tear open white package across dotted line and remove pads.
Pictures on the pads will show where to place them.
Peel one of the white pads completely from blue plastic. Firmly place the pad without the blue plastic on patient's bare chest, exactly as shown on pads. Next, peel second white pad from the blue plastic. Firmly place the second pad on the other location. Do not touch the patient. Analyzing heart rhythm. Please wait.
Stay clear of the person. Make sure no one, including you, is touching the person. Say, clear. Follow the prompts.
Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start compressions.
Give 5 sets of CPR or follow the AED's prompts unless the person moves, begins to breathe, or wakes up. Continue using the AED and CPR until the person moves or begins to breathe or until EMS takes over.
Okay, that will end the presentation today. I know we repeated a little bit with the AEDs. We have the AEDs in the school. Most of the information that you guys, or anything you'll have to do in case of an emergency, will be initial, because then the nurse will come or an administrator will be there. Dr. Lipchick?
Yeah, if anybody wants to come down to the clinic and do any kind of hands-on or wants to go over the practice AED, if you want to experiment and play around with the EpiPen trainers, anything like that, you're all welcome to come down at any time. I mean, of course, let me know when you're coming, so, you know, once kids are here. But please feel free to come down and ask me any questions or play with any of the equipment and get to know anything. That's it.
Okay, somebody wants you to send a reminder email to let them know where the AEDs are in the building.
Oh, okay, I will, and I'll just
Yeah.
tell you real quick right now. The main AED with the EPIs are kept right outside of the front office near the cafeteria. It's mounted right there on the wall, and that's the only one that has the EpiPens in it. There's an AED for the second floor at the top of the 8th grade hallway at the top of the staircase, mounted there. There's an AED located between the two gyms on the wall. And then the final AED is in the coach's office, is where the last one is.
Boys' locker room.
The boys' locker room. Okay. And then I check them every month. As a matter of fact, we just had to have the battery replaced in the one between the two gyms. But every month, that's when you see me going around and I check them. And if anybody opens the doors, the alarms go off, which is good because then it lets somebody know that you went and grabbed it so everybody hears the noise. Anything else?
Okay, I just want to thank Haley. She actually came up to the building with me on Friday because we had to figure out how to work this DVD. Haven't shown a DVD in like forever. So I'd like to thank Haley for coming up here on Friday and help me figure out how we needed to make this happen today. But I have nothing else. Any questions? You guys just reach out to Dr. Lipchick and she will answer. Have a good day.
Yeah, and if anybody wants to review anything, it's recorded and will be posted. Okay,
all right.
Thanks.
Until everybody's out before I can.